lupus is. So should we get started with our first question? Doc, can I ask you, how do lupus patients react to COVID-19? Do we know yet, based on any information available on hospitalization or mortality rates for people with lupus versus the general population? Are we more likely to get COVID? Are we at a higher risk for severe complications? What can you tell us about that?
So it's still early days, but we've been collecting this information as fast as we can, both for lupus and other autoimmune conditions. You could imagine that there may be good and bad things about having lupus as far as your risk of getting COVID. One of the study in the lab, the interferon molecule that Regan already mentioned is upregulated or higher in lupus patients, and it's sort of our defense system against viruses. So you could wonder, maybe that could be a good thing. We don't really know for sure, though, and until you know what happens in real human populations, then that's just speculation. On the other side, you could be concerned because some of the medications that are used for lupus can bring down the activity of the immune system, and so you could wonder if you have some risk of being more likely to get COVID in the first place. We don't know the answer to that yet either. We don't know whether people with lupus are more or less likely to get COVID. The information that we've gotten, I think the most clarity on so far has been from people who are confirmed and diagnosed to have COVID in the hospital. Are they more likely to have a severe case or not? And so far I can say in our own review at my center, it doesn't seem that people with lupus who have been definitively diagnosed with COVID have had a more severe course. I think the somewhat limited access to testing makes it difficult to ask some of these bigger questions about how likely is someone to get COVID if you have lupus, because we really don't probably know the true population burden of the condition in the general population or how many people have been exposed. So far I would say the data regarding whether lupus patients would get it more severely has not shown any signal, although the caveat is that it's still early days and we're still collecting the information.
Are there specific studies out there looking at something like that for lupus patients versus the general population?
Right now, the efforts are really focused on collecting the information, and so the studies are aimed at, understanding how many people with lupus diagnosis get the condition and other autoimmune conditions. I think when we get antibody testing, then we'd be able to answer the question better about exposure. Right now we can only detect active infection, so it's hard to know really the prevalence or the amount in the population, because someone who has already had it would show up as negative on the current test for active viral infection. I think that we are also trying to collect blood samples to get a look at the immune response and to understand how this might differ in people with autoimmune diseases. But this is still very much in the data collection phase. I'll say in New York City, we've really been hit by this, and so we're scrambling to try to take care of the patients and do the research, but it's all a pretty new thing, and so we don't have enough information collected to really make a lot of statements. It will be coming.